All right, first thing I want everyone to grab a silver colored heart. All right, cool. So these are 3D printed hearts, and each of them are cut in the 4 planes of Resuscitative TEE. So if we can go around, tell me which one you got. What do you have there?
Long axis, is that?
This is the mid-esophageal 4-chamber, actually. Kind of hold it up. You got the 4 chambers there. Yeah, see it? All right, what do we have over here?
Mid-esophageal. No, deep transgastric short.
So it's going to be transgastric short axis. Yep. What do we have there?
Bicable.
Mid-esophageal bicable. And what do you got?
Mid-esophageal long axis.
Mid-esophageal long axis. Cool. You see that aortic outflow tract on the long axis there. All right, great. So next thing I want everyone to do is hold the heart in front of your chest as if like you were in a Quentin Tarantino movie and someone just kind of pulled it straight out. It's still beating. It's wild, right? Where does it sit? How does it look? I know they're all gray. It's not painted like red and blue, but all right, cool. Great. We'll tilt yours a little bit, right? Because we have something that can kind of help us out. What's this in the back of the heart?
Descending aorta.
This is my descending thoracic aorta. Exactly. How does that sit? Does it kind of sit side to side, straight up and down?
Straight up and down.
How about straight up and down? And it's located posteriorly and just to the left of midline, right? Okay. Now everyone gets a probe. Here you go. Here you go.
Thank you.
So take your probe down the esophagus, and where's it going to be in relation to the heart that you just extracted from your chest? It's okay. If you drop it, no worries. It hasn't broken yet. We're all good. Maybe look to your clipboard here.
We got quotes on how much they cost.
Well, we'll be charging you. No. Okay, so we're coming straight down, right? So where does your probe lie in relation to the structures you're seeing? Huh? So it's nice. It's right in this little pocket here, right?
Yeah.
Okay. And so that means if my probe is right in this little pocket, that my scanning vector is coming straight out from the probe right in front of me, right? As I'm looking at the heart. Okay. So tell me, knowing where the descending thoracic aorta is, can I see it on my screen? If my scanning vector is kind of right in front of me, I'm the probe, I'm coming down the esophagus. Where is my descending thoracic aorta? You got to rotate to the left. You got to rotate your transducer, right? Because my descending thoracic aorta is kind of behind my left shoulder. I'm going to rotate all the way around, and then I'll be able to see it, okay? So I'll give this to you. I'll hold your heart. Let's say you've rotated around to see your descending thoracic aorta. Can you draw it on your vector? We're just in 0 omniplane. We haven't rotated, so you're just rotating around.
I mean, it's just going to be a circle.
Yeah. Where's it located?
Right beside your esophagus, and then be kind of posterior to the rest of your.
So you're in the esophagus, right? So we correctly drew a circle, right? Because we're getting our short axis. But you're in the esophagus, and you're kind of like, oh hey, there's my descending thoracic aorta.
It's going to be more.
It's going to be really close to you. Yep. So it's not going to be in the far field here. It's going to be in your near field. So go ahead and redraw it right there. Beautiful. So now we have the descending thoracic aorta that we found just by rotating our probe around behind us. Okay? So that's going to be in the near field. You can keep this. Everyone gets a vector. Here you go. And here you go. Okay, great. So now we're going to work with our omniplane bit. So tell me, you are the probe. I like to think that, right? I have my scanning vector right out in front of me. Can you show me 45 degrees with this? I'll hold your. What does 45 degrees look like?
Yeah.
So, think about you are the probe and you have a big clock face in front of you. We rotate the omniplane clockwise or right side down. Yeah? So that's going to be 45 degrees. So can you take me from 0 degrees to 90? Excellent. Can you take me from 0 degrees to 120? Great. And can you take me from 0 degrees to, okay, that's cool, to 160? Exactly. So everyone is going right side down. Okay. An easy way to do it, in a way that I find myself, figuring out the different planes when I'm doing TE, is using my right hand and dropping the right pinky side down. And then I know that I'm always taking the palm of my hand to put it up on the screen. Okay. So that's also kind of a helpful way to do it when you don't have your 3D heart right next to you to take a gander at. Okay. All right. Great. So the main point of this particular station is that you are the probe and we are discovering the spatial relationships between you as the probe in the esophagus and the heart that is stretched out in front of you, including the descending thoracic aorta, which is behind your left shoulder. Okay. So one of the teaching tools that we use is we look at a normal CT scan, right? So normal CT scans, you're looking from the patient's feet all the way up to their head, which is diving through the screen. If I take this CT scan and I flip it 180 degrees, now I have a patient's head here with the feet going through the screen, right? So this is kind of what we're looking at and what we keep talking about. I'm the probe, I'm coming down from the head all the way down into the mid-esophagus to see my structures, okay? So looking at the esophagus here, again, we flip this 180 degrees and we can talk about what you guys just took me through, right? So here's my scanning vector. Where's my descending thoracic aorta? Yeah, so what do we do to find it? One like this, right? And then where was it located? As you drew, right in the near field. Okay, great. So the problem is that when we look on the ultrasound screen, we don't use upside down triangles, unfortunately. So we have to think about this patient that's now lying with their head towards us, feet through the screen, except they're lying on their stomach, okay? What is the first thing that you're gonna see in the near field when you're in the mid-esophagus? Left atrium. Left atrium is your scanning window to the heart in the mid-esophageal views. In the 4 resuscitative views, we have 3 of them that are located in the mid-esophagus, meaning that for 3 of those views, that's going to be the structure at the very top of your screen. What are those views?
Mid-esophageal four-chamber.
Okay, what's another one?
Long axis.
Mid-esophageal long axis. What's the third?
Bicable.
Bicable. Bicable is the one that we always kind of forget about too, because you're so used to associating like, well, when I have an atria, I have a ventricle. They're connected, right? But in the bicable view, you're focusing on that right atrium, but you will see the left atrium as your scanning window in the top view. Okay, great. So again, this is just what we talked about. Here we are in the mid-esophagus. First structure we're going to see on your screen here is the left atrium. Cool. We're going to go through the spatial orientation of the valves as if you are the probe coming down the esophagus. What do you encounter as you're advancing the probe? First thing you're going to encounter here is the aortic arch with the brachiocephalic artery extending off to the right side with the right subclavian and the right common carotid. In the middle here we have the left common carotid artery, and on the left side we have the left subclavian. Okay? On the machines, I'm sure you've already seen this, it's so beautiful, right? You see the 3 vessels, you picked on the long axis of the aortic arch. However, in real people, we have the trachea. And what's in the trachea? Air. And what does air do to our ultrasound images? Makes them crappy. It scatters them. And so we can't see the structures behind any air-filled structure. So just know, in a real patient, as compared to our simulators, you're going to get some washout of some of the structures. And so then by further advancing the probe, you should get past that area and things will become clear again. Okay? All right, great. Next thing we're going to do is we are going to stand up here. You'll be with me. You two are going to be with me, and we are going to use this very cool virtual reality setup. Okay? So, this is your scanning vector. You are the esophagus, the probe inside the esophagus. I want you to hold this. Kind of hold it on the corners there because it uses the camera, so all of a sudden it starts to your fingers, right? Hold it straight over the heart. Kind of rotate this
You
just
really
slightly.
want to stand, yeah, hold
So
on
right,
the sides.
this is what we talked
Everyone's
about.
gonna-
Here's the descending thoracic
So you're
aorta.
gonna go
It's
ahead and start
located
slowly
just to the left
down.
of center and posterior. We're also doing squats in this session, so I want you to slowly start to lower
That would
down.
be there, right? So you can see as you're the probe coming down.
Now look at this. Look at these 3, right? Look
So
at what I
you see
have on
the
the
arch
screen.
and that descending.
Yeah. So if I were to take this
It's gonna go
and
dive
put it
down.
up onto the screen, tell me, what is this
Yeah.
structure?
So Come back up to the great vessels.
Take it again, so I'm here, right? You can see on this, what is this structure?
That's the brachius.
Brachius valve. And coming down, because my vector's shooting out in front of me.
So it's the
There you
brachius
come
about the
On that side.
So brachiocephalic here.
Yeah.
Left
So show me the
subclavian.
brachiocephalic on here.
Left subclavian, yeah?
Here?
Yeah, all right. Let's squat even further. What do we see now?
That's it, okay?
The
So let's,
aortic arch.
so if we
Long
have
axis of
here,
the aortic
okay,
arch.
so this is our
So
vector,
think
right?
of your aortic
So
arch as a
one,
rainbow, right?
2,
And your
3, and we said this was the
pulmonic
brachiocephalic.
artery
Okay.
is shooting through.
Okay.
They're perpendicular to one another.
Left subclavian.
So come
Okay.
down a little bit
So now,
further.
think of this as my palm.
And now you
right?
see
I'm
your
going down, I'm going up
pulmonic
on the
trunk
screen.
in its
So
long
that
axis.
my brachiocephalic
Okay.
is on this side of the screen.
Okay, great.
Make sense?
Yeah.
Okay.
Now that we know that we see our brachiocephalic, or
You're gonna keep going down.
pulmonic
You
trunk
see
in the
it.
long
Arch
axis.
Yeah,
What
and
is
it's
the
in
next
long
valve we're gonna
axis,
see?
and then if you keep advancing, you're gonna
So
see
we have our arch here and the
pulmonary artery
pulmonic
shoot
shooting
out.
through.
Here.
There we go.
And so which
Below the
side is
pulmonic
your,
valve.
Yeah,
where's
what's the
your
next valve?
pulmonary artery?
Mitral valve. Sorry.
The aortic valve, we haven't seen the aortic valve yet, right? We know we've seen the arch. I keep coming down, this is the ascending aorta, and now we see our aortic valve. Knowing that
So go ahead, we'll
the
draw it.
pulmonic valve and the aortic valve
So you're gonna see it right
are
here.
perpendicular to one another.
Right.
You've seen the pulmonic valve in its long axis. Is the aortic valve going to be in its short axis or its long axis? Short axis, right? What's the next one that we see?
Mitral maple graft.
Up and
Awesome.
down,
Okay, so you're gonna
mitral.
see something like this.
And then finally,
If you go down,
tricuspid, you
right, so
move
the
your
pulmonic valve and the
screen
screen
up here.
long
There you
axis.
go.
And you
A
said this
beautiful
was the
four
right
chamber.
side, right?
Yes.
And a great
Okay, so
squat.
this
Come
is
on up
right,
and you're going
this
to
is
take a
left.
chance to
And
kind of
what
look
you can
into
see,
that,
you're gonna see a
okay?
lot more of the right pulmonary artery there.
So
Okay,
go
so we
ahead,
put it up on the
talk me
screen.
through
Because the
exactly
left
what
one's
you're
covered
seeing.
by
You were at
the
the probe and you're
distal
coming down.
Right.
And the right is more exposed to the next to the it's okay.
Cool. Okay, so you're gonna keep going down, and then the next valve that you see.
Right.
Okay, so
Left
this is the
subclavian,
pulmonic valve,
brachius.
this is the aortic valve.
Excellent.
That's
It's
the
almost a perfect short axis.
Okay,
You have to
coming
up down
down.
a little bit.
Moving
Moving down.
like this.
Pulmonic valve.
In its long axis.
The next valve you're gonna
What's
see
next?
below the aortic valve.
Yeah.
So this is the
What's next?
mitral valve.
Excellent.
This is the tricuspid.
Awesome.
Beautiful. Take this from you. Scoot on over here.
Continue to cut through them.
We're getting squats.
All right.
All right. You're taking it through. Just watch for your fingers.
Going?
It's okay.
Yeah.
Right on here. So it's going to attach to
Okay.
this QR. Coming straight down. So you see your three, right?
Mm-hmm.
Coming down, long axis of the aortic arch. Coming down next.
All
What do you
right,
have
so your
here?
probe, you're gonna
Pulmonary,
keep you
then
home.
2 branches of pulmonary.
You got it. Coming down.
Okay, and then slice. All right.
What's
So
this?
we're gonna rotate just
And what's next?
a little bit. Perfect.
And
All right.
then
So you're gonna
the
go
mitral
through,
Yeah,
circling
and then
through the
finally-
right vessels.
Tricuspid.
So you're gonna move down.
Great.
Down, down.
All right,
So you
cool.
see that
Nice. You can just set that right on the
the vessels
QR.
that you're encountering here,
Over
you have
there.
your brachiocephalic, right? It's on the right hand side. Which one's this?
All right.
Break on the club.
Go ahead and take a seat whenever you're done.
Right, okay, because this is your brachiocephalic, perfect. Your left common carotid,
The subclavian.
left subclavian, and you can see when we translate this up on the screen, we're going like this, so the brachiocephalic is up here. Okay, so you're gonna continue advancing down.
So one of the points that I want to make here, that we all do a lot of TTE, right?
Yeah, right.
Okay? So this is what it is.
That is the,
This is a apical four chamber.
Apical four chamber, yeah, okay. So you know how we talked about that we are starting from the pulmonic valve?
This is the right.
Next
This is
we
the
go
right.
into the
You already
aortic
see more
valve.
of it, right? Because remember, this is your descending thoracic aorta, and that's always
Beyond the
overlapping,
aortic
which
valve,
is
the first valve we see is the mitral valve.
So the
Okay.
next valve, so this is the first valve.
And
you're
this
gonna
makes
see.
sense, or somebody
Okay.
that can help me kind of remember
Now
this
we're
is,
gonna-
we
the
know our
next valve we're
tricuspid
gonna
valve is
encounter
closer to the apex,
Right,
right?
short axis, right?
The mitral valve is
Now
further
you
away.
continue descending
If
down,
you
you're
are the
gonna see
pro,
your-
where is your apex located?
Yeah, long axis.
Further away from you, yep. So we're gonna see, we're closer to the base of the heart. So we're gonna see that mitral valve come in first, and then we're gonna see the tricuspid valve, okay? All right, great. And this can really help you when you're doing this particular view, right? You got 10 seconds, they paused on CPR, and then all of a sudden you're like, oh, I can't get my fourth chamber, I wanna get to my home base. What am I gonna do here to get to my fourth chamber?
So we go to the mid-esophagus.
Yeah, I'm already in the esophagus. I'm here, I got this, but I can't get to my fourth chamber. What do I do? No flexion. I'm literally going to advance the probe a little bit further, right? Because I'm to the point where I have my aortic valve here. I see my mitral valve. What's next if I keep advancing further? The tricuspid valve. So now I get to the point where I see my tricuspid valve. Okay? All right, great. Who has the mid-esophageal four-chamber heart? Look at yours. Are you up? Are you on today? Got it. Okay. So I want you to hold the heart in your left hand. Put it back together. We break in hearts, but right now we're going to put it back together. In the anatomic plane, right? So kind of about like this. Perfect. So now I'm going to give you this, and you're going to hold this in your right hand. And you're going to take everyone through how you get to this view.
Okay. So basically, I go down and I start to identify all the
Yeah.
structures to the point in which I can see the left atrium right in front of me.
Yeah.
And then I retroflex a little bit so that I can see in the same plane the tricuspid, sorry, the mitral valve and the apex.
Excellent. So everyone can see here now, when he's retroflexed, he's now created a parallel line at the cut in this heart. Okay? What happens when you don't retroflex is you can get kind of a stumpy ventricle, a foreshortening of the ventricle. So by retroflexing a little bit, you now have full extension of the ventricles. How can I improve this image here? Increase the depth. Where do I do that? On the screen of the machine, exactly. So we're learning a lot of new buttons when it comes to using the probe, but you can still use your gain, you can still adjust your depth like you do in normal ultrasound on your machine. Okay, great. Something that is an application to real world as opposed to what you're going to see on the machine or do on the machine. When you're doing active CPR and you've got that probe inside there, you're already getting enough flexion because of the external forces, so leave your flexion knob unlocked and allow it to be as flexible as you need. Don't try and do the retroflexion because you don't want to risk any injury to the esophagus. When you obtain ROSC and you've saved your patient, you want to get this beautiful view, add a little retroflexion. All right, who has the transgastric short axis? All right, you got your vector. Take us through.
So for this one, you go further down into the stomach.
Further down into the stomach. Exactly.
And then you insert or retract until you're at the level of the pathway muscle.
That sounds great. So what's really nice is that the esophagus will have a natural curve. It will go straight down, and as it enters the stomach, you naturally curve up exactly as you're doing, kind of holding it so it matches up with your heart. However, in our patients in the ER, what's in the stomach?
Beer, pizza.
Beer, pizza, SpaghettiOs, I see, and because he arrested and your EMS guy is just bagging his stomach full of air, right? Which has risen to the top of your supine patient. So this view on your simulator is the best, right? I just advance the probe and it's there. On a real patient, this can be a challenging view because of air in the stomach, okay? So I have the anterior stomach wall. You're gonna have to have a little bit of anti-flexion to bring the tip of the transducer to meet the wall of the stomach, thereby displacing any air and giving you a beautiful view, okay? All right, great. Can you label for me the anterior wall? Just put a little A.
Yes, interior would be here.
Excellent. Okay, great. Can you tell me what this wall is?
So this is the inferior wall.
The inferior wall. Great job. So we are accustomed to think, anterior, posterior. We take AP x-rays all the time. But in the heart, according to the left ventricle, you're going to have anterior, inferior, septal, and lateral, okay? Everyone take their 3D heart. I'm going to borrow yours for a second. These are so awesome because you can realize why that is, okay? So I'm thinking about the left ventricle, I have the anterior aspect of the left ventricle. But what's this? It's more inferior. And posteriorly, you have some of these vessels here, and maybe, part of the right ventricle, but the actual part of the left ventricle is more inferior, anterior, lateral, and septal, okay? It's gonna make a difference when we head to our vertical plane, which is some of our most challenging. So who is the mid-esophageal long axis? That's you, okay. So I actually want you to start at 0 and take me to 90.
So I would come down until you would get your mid-esophageal four-chamber.
Home base, perfect.
And that's 0. And then just start turning the ultrasound beam until you're at the 90.
Okay, great. I'm going to take this from you. So we're holding it like this, right? Okay. Can you tell me which is the anterior wall and label it with an A? Yeah. And you can hold it in front of you and redo it. Excellent, yeah. So your heart and vector is right in front of you. You labeled this with an A, yeah? I'm gonna come up on the screen like that. Okay. Really helps with your hand here, holding it right here. I'm dropping my right side. Oh, this makes sense. A, anterior, inferior aspect. Make it like this, okay? We're gonna take it one step further, all the way into the mid-esophageal long axis. Okay, it'll take us from 0 degrees to 120 or 130. Great. And now it matches up with the cut on your heart. So what wall is this? So something's septal, right? Because we have a septum here, so like, okay, that's the easy part.
Anterior septum. Anterior septum.
Anterior septal. Now look at him holding the heart. This makes sense, right? He has the septum up on top, on the anterior aspect. So then what does that make this wall? Infralateral. And again, using your hand kind of helps you. All right, I know that I'm seeing, I know this has got to be the right side of my heart because I'm seeing the RV. I have the septum, and it's on top. Anterior septal, inferior lateral. Yep. All right, and who is the bicable view?
I do.
All right, grab your vector and take us through.
So, coming down, mid-esophageal, 4-chamber.
Yeah.
Turn to the right to get RA, mostly in the middle of you.
Like
I'm
these.
going to go to 90 degrees to show the bicable.
Okay. You know what? I'd like to see a little bit more of the IVC.
Oh, okay.
How are you going to show me?
I thought you were going to say like pep or...
No. No, a little more cut next time. Actually, that would be so great. Now, show me more of the IVC. What are you going to do?
IVC, I would advance.
Advance the probe. Okay, no, actually, can I get a little bit more SVC in this grade?
Draw the probe.
Okay, great. All right. So, you've gone like this, right?
Okay.
Okay. And now we're going to take that up and put it on the screen. So can you tell me what this is?
SVC.
SVC. And what is this? IVC. Excellent. And then the final question, what is this? Left atrium. Okay, great. Do you guys have any questions? No? You did a great job. That's cool. You got through all the stations. You learned a ton. And now you're kind of translating it to seeing the spatial aspects of it. So this has been helpful to think of using your hand and then always putting your palm up on the screen, because oftentimes when you're in resuscitation, we don't have fancy learning tools like this, but this is always pretty helpful.
Are you EM?
Yeah.
An academic center?
Hybrid academic
really?
community. Yeah.
Okay.
Yeah. So.
I know. You've got some patience.
Yeah. Right? Oh my God. For sure.
Have you seen the UU peri-op anesthesia videos, University of Utah? They always talk about on the screen the little fingers for the left side.
Yeah.
So that kind of always helps me kind of remember.
Exactly.
Because palm I get, but I kind of, it kind of every once in a while.
For the left side of the screen.
Yeah, so
Definitely. Yeah, for left side screen, because otherwise, when I think that I am the probe, right, my little finger is my right finger. It's on my right side. But yeah, left side, so little finger on left side of the screen, or palm towards the screen. And then another thing, if you guys are eventually going to be taking any tests, forward echoes, things like that, this is important. So this is your little omniplane indicator, and you may get questions that show you echo views, right? And they can be confusing because our transgastric short axis looks exactly like our what in transthoracic echo. So it looks like a peristernal short axis, yeah. But if you see something like this, you'll know right away this is a TEE image. And And so then that can help orient you, because there's a lot of questions that ask things like, you know, what wall is this? Or what structure is this? And so, yeah. Cool, lunchtime. Thanks, guys.
Thank you.